Hello, I'm Carrie Watson with the CMS National Training Program. I'm joined by my colleague Kim Lair, who will be helping with technical assistance. Welcome to today's webinar on eMedicare, Improving Compare Tools. Care Compare will help people with Medicare make informed decisions about their health care. Today we want to show you this improved redesign of the 8 existing Compare tools into a single user-friendly interface with quality, price, volume, and other data, which will be available on Medicare.gov when we launch it in the coming weeks. We're very pleased to welcome Chris Kepke from the CMS Office of Communications, the Director of Strategic Marketing, who will kick things off in just a few minutes. Nate Mudd, the Director of the Division of Web Development, who will be leading us through the demonstration, and Linda Klingensmith, the Product Owner for Care Compare, who will assist in answering questions that you type into the Q&A box, which is located on the left side of your screen. We will have time after the presentation and demonstration to answer the questions that you type into the Q&A box. And now I'd like to go over a few other technical issues with you. You can choose to listen using your computer's audio, or you can mute your computer's audio and use your phone by using the dial-in number on the left side of your screen. All phone lines have been muted so that everyone can have a good learning experience. Closed captioning is available on the screen for those who require a text version of the training event. And lastly, a recording of today's webinar will be available within a week on our webpage, and we'll share this again at the end of the presentation, CMS National Training Program at cms.gov, and it will be under the Resources tab. This CMS National Training Program webinar provides basic information. You should always consult the relevant statutes, regulations, and rulings for official legal guidance. Also, this call is intended as an informational call for partners. It isn't intended for press purposes and is not on the record. If you're a member of the press, please email our press office at press@cms.hhs.gov. And now I'll turn things over to Chris to get us started.
Good afternoon, everyone. Thanks for joining us today. So this project we're going to talk about today, Care Compare, is part of our eMedicare program, where we've been improving a lot of our tools across the Medicare.gov realm. So we're making improvements in today's tools to help people with Medicare find information about healthcare providers and services. And part of the eMedicare initiative, we're going to offer patients a more streamlined Compare experience, improving their ability to find information about doctors, hospitals, nursing homes, and other healthcare services. And we just wanted to take this opportunity to show you Care Compare before we release it later on this summer. And one thing I do want to note, though, is this is a change in how we are building the websites for these Compare tools, all into one Compare tool called Care Compare. We are not changing how we actually measure quality. That's a whole different program. This is just how we publicly report it. So what are we launching? Care Compare is a redesign of the 8 existing Care Compare tools into one single user-friendly interface with quality, price, and volume and other data to help people make informed decisions about their health care. Our vision is to redesign the 8 original Compare tools, so that's hospitals, home health agencies, nursing homes, hospices, inpatient rehab facilities, long-term care hospitals, physician and dialysis facilities, into a similar interface. Some of you may know, I imagine if you signed up for this, you're somewhat familiar with the existing Compare sites, and you know that many of them have differences in design elements. We're trying to make the design elements similar across all of the Compare sites in Care Compare, so that people who need to move, say, from trying to find a nursing home to trying to find home health, trying to find a hospital, that they're not having to learn a different interface every time they have to go back and forth. We're also adding intuitive search and compare functionality. We want to empower patients, as always, and their families to help find the best care for themselves. This is going to exist on Medicare.gov, which is a website designed for people with Medicare and their families and caregivers. And it's going to continue to evolve. Just because we're releasing it at the end of the summer doesn't mean that we're finished. This is an ongoing process. Some of the highlights for people with Medicare is the consistent look and feel across all settings and more intuitive. One-click navigation, so if you do need to switch between care settings, it's one click. You don't have to go back and start a new care setting all over again. Mobile-friendly. We are improving mobile functionality. As you know, there's a lot of information on these sites. So that took the designers a lot of work, and I think they've done a wonderful job. And enhance the experience with easy-to-find and follow helpful instant guides when selecting a care setting. So there's things like next steps for choosing a doctor to pop up to give people hints on what they might want to look into when choosing a doctor, as well as a nursing home and what have you. So what's our timeline? Some of you may have noticed that last January, we announced we were going to be doing this through a blog announcement. Throughout February and March, we gathered quite a bit of stakeholder feedback, including at the quality conference, which if you were there, you might have gone to a couple of our presentations, as well as we were out in the hall trying to stop everybody in the world to take a look and give us their feedback. And we got hundreds of people's feedbacks on the site through these processes. Also, during this time, we've done multiple rounds of consumer research to get feedback to help us make this better for people with Medicare and their caregivers. So late summer is Care Compare, and you see here it also says and PDC launch. So I do want to say something very quick about PDC. We did have a webinar 2 Mondays ago on PDC. Hopefully you were able to join us for that. I am pretty certain it is posted for people to be able to go look at that. But that's the companion site for the data sets that people might want, if they want to do their own analysis, they want to do their own downloads and those types of things. So PDC is that, and it's going to exist on CMS.gov, which is more for stakeholders. Care Compare is going to exist on Medicare.gov, which is more for consumers, beneficiaries, and their families. There will be a little bit of a transition period. We're going to put up Care Compare in PDC, but they're going to run in parallel with the current tools for several weeks. I can't guarantee how long, but we will be doing it at least through early fall, if not into mid and late fall. And then the future, we will sunset the original Compare tools and information on data.medicare.gov, and all of the information will simply reside on Care Compare and PDC. So that's pretty much where we are right now. That's my introduction. And I'm going to turn it over to my colleague, Nate Mudd, who's going to give you a demo of the site.
Thanks, Chris. Good afternoon, everyone. I'm going to quickly get my share screen set up. Very excited to do this demo and show you the new Care Compare experience. At this point, everyone should be seeing the new landing page of the Care Compare experience. And before I jump into some of the features, I just want to walk you through what you're seeing. So the main user interaction that most users will end up using is this search area right here. This is where you'll be able to put in your location, the provider type you're looking for, and optional keywords that will help users filter down their information. Below that, if a user wants to learn more about the different settings, they're able to navigate any of these icons and labels where they can click and learn a little bit more about those that specific setting. And below that, there's some additional tips and resources that some users may find helpful. Before I jump in, I also want to share the What's New area. This is where we're going to put important information that users may be interested in. For instance, data that might be being updated, different changes to the experience, or important information, for instance, around COVID-19. Now let's jump into the interface. If the user wishes, Care Compare will use the device location of the user. And for this demo, I'm going to put in a different, you can search by either city or state, or you can search by a zip code. Next, I'm going to choose a provider. Let's start off with doctors and clinicians. You'll notice that the field changed, that it's specific to the type of setting. So in this scenario, It's fully optional, but you can enter a provider's name or a group name or a specialty. You're also able to pick some common or popular searches that other users are having. So for this case, I'll use general practice. Now we've jumped to the results page. And so let me talk through a little bit of what you're seeing here. At the top, you have an area, the same search boxes that were on the landing page are now carried over to the result page. This allows a user to jump between any setting that they wish. You can quickly, right here, click a different setting and jump to a complete search on different settings. You also have a map view, a filter area, which will change depending on the setting, and the results cards, which have the most important information that a user may need as they're searching for providers on Medicare.gov. As you scroll, you'll also notice this next step area. One thing we've learned from user research is a lot of beneficiaries are looking for like what to do next after maybe they found a provider that they'd like to act on, or they maybe have more questions. So this will launch a tray that helps beneficiaries give them additional information on choosing providers and sets them up to do their next step. And as Chris mentioned, we're also starting to surface important cost information. So you'll notice at the bottom of the physician setting, we are starting to surface cost information. In this case, what's the cost of seeing a general practice physician or a returning patient, the max, min, and the most common costs associated with that type of visit. You're also able to see additional details about how that cost is calculated. Now, before I continue, let me show you the other feature, which we, as Chris mentioned, going from 8 individual tools with different user experiences and moving into one experience, we really think this is a value and benefit to beneficiaries, being able to jump and staying in the same tool to different settings as they're searching for different care providers. I'm going to go ahead and hit search. You'll notice that the filter tray right here has updated based on filters or information that you'd want to filter hospitals on. Now you're looking at the hospitals that are within a 10-mile radius of Catonsville, Maryland. You also are able to sort. By default, it's set to closest, but you're able to change the sort to either based on overall rating or patient survey rating. The 2 ways to navigate are by just scrolling through the different result cards, or by using the map, and that will take you to that specific hospital. There's also pagination for more, if there are more results, and in this case, we're showing 15 of a total of 17 hospitals. You can also change that radius out. If you can imagine being in a more rural area, users may need to extend their search area. So now we're showing 15 hospitals of a total of 32 hospitals. There are also additional filters where you can filter by overall rating, star rating, overall survey rating, emergency services, and different hospital types. Users can print this page in a print-friendly form if they need to take it with them. And then what I also want to show is there's an ability to, if you have your Medicare, your My Medicare account, you're able to actually save your provider favorite and to come back later. You can also compare up to 3 positions. So let me go ahead and pick 3 at random. You'll notice that these are being now added to this compare tray up top, and you can hit the compare feature. Now what you have is at a glance information side by side to help people differentiate the differences between the 3 hospitals that I've chosen. This isn't all the information we have on hospitals, but this is the information that is most helpful for a beneficiary to really make a decision about a specific hospital. So you have the top level information here on the overview, and then what you have is all of our quality ratings and accordions below. So a user can open as many of these or search at a glance the one that's most important to them. This page is also printable. So now let me jump back to the search results page where we can go to a details page and drill down into a specific information we have on hospitals. So up top, we have the most important information that Bennies need. In a lot of cases, that's the overall ratings, the address, and the phone number. But then we have the additional information. We have the overall rating, the patient rating. We have the details around that, which pop a modal where users can drill down into that information or print it. Patient survey with a similar user experience. And then the additional measures that we have grouped. I'm going to jump into just at random a specific group of quality measures. And you'll notice that all this information is being surfaced in the exact same way so that users can easily read it and scan it to help them make good decisions. Below that is details, and below that is, again, a location and the ability to get directions. Let me go back. I'm going to jump to another facility type or another setting, and let's go to nursing homes. So now, again, you'll notice the filter tray changed to the pertinent information for that specific setting, and the map updated, and now we are looking at nursing homes. Now, the important thing to remember here is even though we're looking at different settings, the information is shown in a very similar user experience. While the information details might change based on the setting, the navigation is similar no matter which setting you're searching on. And again, measures are being surfaced in a similar fashion, and you can, a user doesn't need to necessarily learn a different tool when they're looking at information. That is the main functionality of the new Care Compare experience. Not sure if this will work, but I'm going to try to also show one thing Chris highlighted is the mobile optimization. Yeah, I think this worked. So now you notice, well, I'm not on the mobile device, I just shrunk my browser. You can imagine a user coming either on their tablet or mobile device, which there are more and more Bennies that are interacting with the web through a smartphone or tablet. They can now get an optimized view of the same information that they can see on the web on their mobile device. Okay, with that, that concludes the demo of the new Care Compare experience. I think at this point, we're going to be opening up to questions. I'm going to stop sharing my screen, and I'm happy to share it if it helps. It helps with Q&A.
Great, thank you, Nate. And if you haven't had a chance to enter a question, you can go ahead and type those into the Q&A box at this time, and I'll turn things over to Linda to ask some questions.
Thanks, Carrie. Hello, everyone. We have quite a few questions rolling in. First of all, Nate, could you, Nate or Chris, just repeat again when we're planning to release Care Compare? Nate, I'll leave it to you.
So right now, we're planning on releasing it late this summer. We don't have an exact date to share with everyone, but one thing about how we're rolling this out is that we will be rolling this out in, side by side with the existing quality tools, and that will allow people to get used to the new experience, toggle between the two, and provide us feedback during the time where both tools are running side by side before we sunset the legacy quality tools. Thanks.
Great, thank you. We did receive quite a few around cost. I think, Chris, maybe if you could answer this, could you say more about how costs are being calculated for physicians? Is it from the cost measures in the MIPS and out-of-pocket cost? If you could touch on that.
Thanks, Linda. The costs are actually really simple. They're out of the fee schedule. I know that, you saw it up there pretty quick. We've actually talked to quite a few physician groups around the release of this information. As you can see, it's down a ways in how it's being shown to people. It's kind of us dipping our toe in an area where we hope to do more and more cost work in the future in different care settings. So it's from the fee schedule, and we have lots of caveats. So, for instance, we know what we did is before I get to the caveats, I'm so sorry, but what we did is for all 114, I think, different doctor types in the fee schedule, they're allowed to do an E&M code of 1 through 5 for its intensity. So we looked at the modal that anyone gave for a new patient versus a returning patient, because those are two different fee schedules. And then we basically demonstrate the modal response. So the modal response for a dermatologist might be different than the modal response for primary care doctor. So depending on what specialty you're looking at, we're providing the modal response of a code for a visit for them. Then we do offer lots of caveats. We know more happens at a visit than just a visit sometimes. Sometimes they call in someone else to help look at stuff, a consultation. Sometimes tests are done. And so we provide all the caveats to say that obviously these things can happen during a visit that can alter your costs. Also, if you're on a Medicare Advantage plan or if you have a supplemental Medigap policy, your costs are going to be different as well. But generally, it's just our beginning to say, hey, why don't we just have a little transparency about how much this costs for people and how much Medicare is paying? So, so this is the beginning of that level of transparency. Thanks.
Thanks, Chris. Our next question is there any indication or indicator of a provider is taking new Medicare patients or not?
So, Nate, I'm happy to take that as well, and most of these will fall on Linda and Nate. At this time, we don't have that. I think we all acknowledge that would be a great thing to have. It's such a constantly shifting environment out there that we're not able to capture that accurately. The best thing that people have to do is contact the providers themselves to find out if they're taking new patients.
Great, thanks, Chris. One of the questions is how often are the data updated that underlie the analysis that is displayed? We're going to continue to maintain the regular refresh and release schedule, so nothing is going to be changed there. As you know, some of the compare tools refresh on a quarterly basis, while others refresh on a monthly basis, so we are going to maintain that schedule. The next question, the current hospital compare site has a summary file under the data tab that shows you the source data and the data time period. How do we find this in this new site?
Linda, I might need your help with that one, but there is a way. We are able to show that when the data has been updated. Maybe you could elaborate a little bit more from a.
Yeah, sure. I'd be glad to. A lot of the information that's currently on the compares under that data tab, it's really technical. It's really not for consumers. They have a really hard time with that and often get frustrated and overwhelmed. So what we did was that relevant information is now on the provider data catalog. And we have numerous links, various locations on Care Compare that will take you over to the data sets and that will also provide source of information, et cetera. Okay, thanks. Let's see. I think, Chris, you touched on this in the intro, but could you talk a little bit about, will the system translate to a mobile platform?
Yeah, and I actually think Nate actually gave a little demonstration of that. And we do think that one really nice piece here is that it will be more usable on a mobile platform, and as we are making those types of upgrades to Medicare.gov as a whole.
Okay, great. Thank you.
Just to add, we spent a lot of time focusing on the mobile version. Each year, as we looked at our analytics, there's the amount of users that are viewing Medicare.gov and trying to find information on a mobile device has grown exponentially. And so the team and through our research has spent a lot of time in kind of perfecting that view. And we think that will be a big value add, especially to the Medicare beneficiaries as they're trying to get information in some cases when they're at the doctor's office or when they're out and about. And so we do think that getting at that data will be a lot easier now.
Okay, Nate, would you also mind maybe talking a little bit more? We're getting questions again about whether or not Care Compare is going to be replacing the various Care Compare tools. We've had a couple questions on that.
Yes, so right now the plan is to launch Care Compare and the Provider Data Catalog late this summer. When we do that, we will be running this side by side with the existing quality tools. But at a certain point, when we've ensured the quality and that the new tools are meeting and achieving everything we had hoped, we will be then sunsetting all the existing tools. That includes Physician Compare, Hospital Compare, all 8. And that users will either be using the Care Compare experience on Medicare.gov, or for those interested in the underlying data set, we'll be using the Provider Data Catalog. But yes, these 2 tools will be replacing the existing quality tools.
Great, thank you, Nate. The next question, the current site gives you the option to drill into graphs to get more detail. We get graphs with numbers, better than, not better than, worse than, et cetera, on the workflow. The presenter was scrolling so quickly that I couldn't see. So, Nate, you want to talk about that, about the graphs?
Yeah, I can start on that. The existing graphs and some of the additional underlying information, while some of that information is surfaced in a new, clean, and consistent way, the graphs are not on Care Compare. Based on our analytics and based on our user research, we found that seldom were these graphs and this information viewed, and if they were viewed based on our user research, they're almost always very difficult for the beneficiary to understand. That being said, for the information that it was most important for beneficiaries, we did port over parts of that information into the new tool. And I apologize, we didn't go deep into every piece of data that was on the quality measures. This was more at a glance. We welcome that when this launches to collect additional feedback and through the tool to kind of hear your guys' thoughts. But the graphs are not on Care Compare. While all the data is on Care Compare or the Provider Data Catalog, we believe what we've tried to do here is provide the beneficiary and other users with just enough information so that they weren't overwhelmed, but also kind of give you kind of a drill down of clicks. For those who needed additional information, they have Provider Data Catalog. But sorry, that was my long way of answering. The graphs are not on Care Compare. Much of the information that was through those graphs is some of it is showing up in Care Compare and or Provider Data Catalog.
Okay, great, thank you. Another question that's come in is there a site to compare costs for Medicare procedures?
And so there is a tool on Medicare.gov that compares specific procedures, national averages between ambulatory surgical centers and hospitals. we are looking in the future on adding more and additional information around costs, and we recognize that that's one area around price transparency and to help beneficiaries kind of make decisions about procedures. But at this time, the main area that we have is the procedure price lookup tool on Medicare.gov.
Okay, we still have a little more time if anybody has any more questions.
Linda, this is Chris, and I just noticed that a few people have typed in just questions around measures in general, and I just wanted to just reiterate what I said earlier in the slides, which is that we are not changing measurement at all. So what you were able to do, your ability to look up certain measures is the same. They're all the same measures that have been there. The measurement changes at CMS through, a large process that is not related to the building of the website. And then back, we are defaulting to showing the measures, the results of the measures in ways that we have found were most valuable for consumers. But every measure is there. So, because some people are asking about measures, and I just saw that in the chat, so I wanted to cover all of those questions with one sweeping answer.
Thanks, Chris. And just to dovetail on that a little bit, we've had questions around the star ratings reflect the revised methodology that was to be implemented in their calculation. And we are only publicly reporting the data and information that is given to us to post on the site. The calculation is done by colleagues within the clinical standards group and their contractors. So if there have been updates to the methodology and calculation and they have been forwarded, then the star ratings would reflect that.
Okay, are there any other questions? Linda, are we through all of them?
We're pretty much through all of them, yes.
Okay, well, thank you so much. Thanks, Chris, Nate, and Linda. That concludes today's presentation. As a reminder, the recording of today's webinar will be available on our webpage, CMS National Training Program.cms.gov, under the Resources tab. Thanks for joining us, and have a great day.